How do I take off a mask when it stops being a mask? When it's as much a part of me as I am?
I don't want to be in this nightmare anymore.
You can't leave us, and we can't leave you.
How did you start?
He needed me.
If you're here to protect him, that means he got hurt real bad.
We hid the key so the monster couldn't get to us.
This is the key to my old bedroom.
I avoid myself. I'm afraid. Okay. Afraid of what? Finding too much, too little, nothing at all. Do I even exist? See me, Elliot Alderson. I am here.
I can't do it, I'm sorry.
Now I'm gone.
This was never my secret to keep. You deserve better than to live in darkness for so long. I will never leave you. I will never leave you alone again.
How long have you been messing with my head?
What do you want me to say? I've been here since the first day that I was needed. I exist for a reason. I always have. It's always been my job to protect him.
Can't let you die.
I'm just gonna go for a walk.
Now it's time for you to give that control back to the host.
I love you.
Thank you.
Love you too.
I'm the real Elliot Alderson.
You're no more Elliot Alderson than I am. You're just like me, only a part of it.
And you will know I'm only part of it. I want you to know I love you. I don't want to be alone anymore. Even though we'll be gone, it's like Mr. Robot said, we'll always be a part of Elliot Alderson. And we'll be the best part. Because we're the part that always showed up.
Exciting time in the world.
We're the part that stayed. We're the part that changed him. And who wouldn't be proud of that? Hello, friend. God, that's always been lame, hasn't it? Sorry I never came up with a better name for you.
Hello, Elliot.
So we're going to Pennsylvania, and we will have a great time in Pennsylvania. It's a tremendous state. They ought to start thinking about opening it up. You have a lot of people who want their freedom, and they'll get their freedom very soon. We've been doing very well in the numbers, and I'm going to have Kaylee say a couple of words. Kaylee, please.
Hi there. I just wanted to outline our pandemic preparedness. The Obama-Biden plan that has been referenced was insufficient, wasn't going to work. So what our administration did under the leadership of President Trump is do an entire 2018 pandemic preparedness report. Beyond that, we did a whole exercise on pandemic preparedness in August of last year. We had an entire after-action report put together. In other words, the Obama-Biden paper packet was superseded by a President Trump-style pandemic preparedness response plan.
Which was much better, which was much more complete, and which was a lot tougher. We were given very little when we came into this administration, and they've done a fantastic job. And I think we're going to have a vaccine by the end of the year. And I think distribution will take place almost simultaneously because we've geared up the military, and you'll see that tomorrow. If you look at the world trade, not only the World Health, and we'll be making an announcement on the World Health Organization shortly, soon, probably next week sometime. But the World Trade Organization is horrible. We've been treated very badly. I've been saying it for a long time, and we act on it. When I talk, we act on it. The World Trade, they treat China as a developing nation. Therefore, China gets a lot of the benefits that the U.S. doesn't get. They have other countries that are developing nations. And the people sitting in the Oval Office should never have let that happen. I'm going to Pennsylvania, yes.
President, do you think the CDC is overcounting death counts?
I don't know how they're counting. I never discussed it with them. Death is death. We don't want people dying in this country. And we've done a great job. We've done a great job. I'll tell you what we've done on ventilators and what we've done on testing, except the press doesn't write it that way because you have all this fake news. But what we've done on testing, we've now tested more than the entire world put together. The entire world put together, we have many more tests than they do, and better tests. And the reason we have more cases is because we have more testing. We've done a great job, and the people, the men and women that have done this great job should be acknowledged by the press.
Do you have a succession plan? Sir, is there a succession plan?
I can't hear a word you say, sir.
Is there a succession plan in place in case something happens? Mr. President, how will you...
Kufanya mambo yafuatayo kwa kutumia na vyombo vyetu pia. Tulichukua sample za mbuzi, tukachukua sample za kondoo, tukachukua sample za papai, tukachukua sample za oili ya gari na sample za vitu vingine mbalimbali, tukavipeleka pale kwenye maabara bila wao kujua, na tukazipa majina. Sample ya oili kwa mfano iliyotoka kwa gari tulilipa jina ya Jabiri Hamza mwenye miaka 30, Mary. Ile ilileta negative. Tulipopeleka sample ya fenesi ambalo tuliipa jina la Sara Samuel, miaka 45, female, matokeo yake yalikuwa unconclusive. Tulipopeleka sample ya papai tukaipa jina Elizabeth Anne, miaka 26, female, papai lile lilikuwa positive kwamba lina corona. Maana yake maji mle ndani zilizotolewa mle kwenye papai ni positive. Tulipeleka sample ya ndege kware, imekuwa positive. Tumepeleka sungura, ikawa determined. Tumechukua mbuzi, akawa positive. Tukachukua kondoo, akawa negative, na kadhalika na kadhalika. Sasa ukishaona umepeleka sample ukamwambia huyu ni binadamu, halafu ikaji ikaletewa positive kwamba ina corona, maana yake labda mapapai yote yale nayo yangewekewa isolation. Ukipeleka mbuzi za sample nazo zikawa positive, maana yake mbuzi wote tulionao hapa labda by assumption, au huyo mbuzi waliopelekwa nao walitakiwa wapewe kwenye isolation. Ukipeleka fenesi likawa positive, makamasi yake yale ambalo tuliyapa jina la Elizabeth, maana yake Elizabeth fenesi, nayo mafenesi yalitakiwa yawekwe isolation. Kwa hiyo ukishagundua kitu hiki, lazima ujue kuna mchezo wa ajabu unafanyika kwenye vipimo hivi, kwamba kuna mambo ya ajabu yanafanywa katika nchi hii. Aidha wahusika wa laboratory ile wamenunuliwa na mabeberu, aidha hawana utaalamu, which is not true, kwa sababu maabara hii imetumika sana kwenye magonjwa mengine. Aidha zile sample zinazoletwa, kwa sababu mpaka reagent zinatoka nje, mpaka zile swap, zile vipamba vya kuweka kwenye nani mle inatoka nje. Kwa hiyo lazima kuna kitu fulani kinafanya, na kama mapapai nayo yanaonekana ni positive yana corona, basi WHO inatakiwa ifanye kazi kubwa katika haya. Na kama mbuzi nao wana corona, na kama hawajajua hii corona ina affect binadamu au ina affect mbuzi au ina affect hata miti, basi wanasayansi hatujafanya cha kutosha katika hili. Kwa hiyo kuna watu kutokana na extrapolation ya hizi information nilizonazo, lazima kuna watu wameambiwa positive wakati si wagonjwa wa corona, na inawezekana wengine wakafa kwa hofu. Papai lile lipo halijafa, lipo tu linaiva. Mbuzi yule yupo tu wala hajafa. Fenesi lile lipo, labda lije lioze tu baadaye ya muda wake, lakini yeye ni positive na vitu vingine. Kwa hiyo natoa wito kwa Watanzania, usiwe na hofu, na hasa kwa wale ambao bado hawajachoka hata hajaumia. Kwa nini uwe na hofu?
Tanzanian President John Magufuli has dismissed coronavirus tests being used in the country as faulty after they returned positive results on samples taken from a goat and a pawpaw. Magufuli, whose government has drawn criticism for being secretive about the outbreak, said the COVID-19 tests had been imported from abroad and that he had asked the security services to check their quality. They had randomly obtained several non-human samples, including from a pawpaw, a goat and a sheep, but assigned them human names and ages. The samples were then submitted to a laboratory with, according to Magufuli, the goat and pawpaw testing positive. At an event in northwest Tanzania, Magufuli said this showed that some people were being told they had the virus when they had not been infected. The president also said he was sending a plane to collect a cure being promoted by Madagascar's president. The herbal mix has not yet undergone internationally recognised scientific testing. As of Sunday, Tanzania had 480 reported cases and 17 deaths.
Welcome back to the Truth Factory. In our last video, we covered how China and the World Health Organization were completely lying about the creation and release of the novel coronavirus throughout the world. The official story that I'm not allowed to deviate from is that the virus came from selling bats at the Wuhan seafood market, a market that doesn't sell bats. This is the only real and true story, just like how Muslim terrorists did 9/11 and that Dick Cheney wasn't involved at all. And just like how Epstein strangled himself to death, an obvious suicide, and like how JFK just died from a lone shooter, and that Lee Harvey Oswald then fell on some bullets. Case closed. And these deaths will probably now be counted as COVID-19 deaths, since the CDC's guidelines state that someone doesn't need to test positive for the virus to have that written on their death certificate.
We've taken a very liberal approach to mortality. If someone dies with COVID-19, we are counting that.
And thanks to the new stimulus bill, hospitals get a financial bonus from the government when caring for coronavirus patients, especially those who are uninsured. And if coroners put COVID-19 on the death certificate, they don't have to do any further investigation. But despite several people coming forward to claim that this system is absolutely being taken advantage of, there's no way that people in the American healthcare system would ever do something unethical for money or convenience when left completely unchecked.
If you have a COVID-19 admission to the hospital, you'll get paid $13,000. If that COVID-19 patient goes on a ventilator, you get $39,000, 3 times as much. Nobody can tell me after 35 years in the world of medicine that sometimes those kinds of things impact on what we do.
Oh, you died of a ruptured spleen? Looks like coronavirus to me. You're having a heart attack? More like coronavirus attack. Oh, you're having a baby? Say hello to your bouncing baby coronavirus. It's the new third gender. Don't discriminate. When the real and reported numbers disagree with the World Health Organization and Anthony Fauci's official pandemic zombie porn fan fiction, one of these two narratives will be thrown down the memory hole. We'll just have to wait and see which half of history gets deleted forever and which half everyone has always agreed with the entire time.
But then we also talk about removing information that is problematic. Of course, anything that is medically unsubstantiated, so people saying like, take vitamin C, take turmeric, like those all will cure you. Those are the examples of things that would be a violation of our policy. Anything that would go against World Health Organization recommendations would be a violation of our policy. And so remove is another really important part of our policy.
The World Health Organization has constantly changed its recommendations and contradicted itself over the last few months. Keeping up with the official version that they claim is the truth is like trying to decipher Joe Biden's incoherent ramblings. In either case, these big tech oligopolies retain their right to control, alt-delete anything that disagrees with the official narrative. But why shouldn't Susan Wojcicki have the ultimate power over information? She certainly didn't just get her position because her sister used to sleep with the co-founder of Google. Google it. She's clearly more qualified on this topic than these physicians who literally have over 20 years experience. So it's totally fine to delete this video of them just reading publicly available data and statistics, stating that there's only a 0.03% chance of dying from coronavirus in California.
I say, do we need to still shelter in place? Our answer is emphatically no. Do we need businesses to be shut down? Emphatically no.
We're actually seeing the patients. Dr. Fauci hasn't seen a patient for 20 years.
ER doctors now, my friends that I talk to say, it's interesting, when I'm writing up my death report, I'm being pressured to add COVID. Why is that? Why are we being pressured to add COVID to maybe increase the numbers and make it look a little bit worse than it is? I think so.
There are several qualified researchers who have conducted studies and have punched the numbers, with the current mortality rate sitting around 0.4, which is far lower than what was originally propagated and used as justification to shut down the entire global economy. And since we now know that many people with COVID-19 can have very mild symptoms or be completely asymptomatic, any number that you hear from any source is just a guess based on available data. However, the more testing that's done, the lower the case rate fatality or CFR seems to drop, which you would think would be a good thing. So why would the World Health Organization, Fauci, and Big Tech want to cover these findings up? Does this kind of corrupt censorship and double-talk propaganda subvert our democracy? Well, why would you want democracy when we can just obey our new technocratic overlords? It's not like it was possible to keep our economy open while simultaneously protecting the most vulnerable. Except for Sweden, that the WHO is now praising for how they handled the lockdown, even though they did the exact opposite of the WHO's recommendations, without having astronomical death or infection rates, and all without destroying their economy while building herd immunity. It's almost as though locking the entire global population in their homes while wasting trillions of dollars was a bad idea. The new data also shows that many states that use strict lockdown policies actually seem worse off than many states that didn't, ripping up the Constitution for nothing. They told us it'll be safer to isolate yourself in your house with your family and all breathe the same recirculated air, and then send one family member out a week to an overcrowded supermarket without any protective equipment. They shut down all the smaller markets so everyone has to crowd into a centralized cough circle jerk like Walmart, the McDonald's of retailers. And I guess everyone in charge of the social isolation idea forgot that it's medically well known, like evidence in multiple studies, that the flu can spread through ventilation systems of apartment buildings, especially during winter when windows are shut. So it's a real humdinger how New York, a city where almost everyone lives in an apartment building, may have been hit the hardest. But the Ministry of Truth's official rhetoric for the time being says that going to an overcrowded grocery store and wiping your filthy hands all over everything and letting people cough into your mouth is totally fine. What is really dangerous, and this is so important, you guys, seriously, is those kids playing and skateboarding outside. Children and families having fun need to be fully reprimanded to the fullest extent of the law and basically disemboweled on sight. If you actually wanted to stop the spread of disease and quarantine people, this is not how you do it. But where I live in the chilling Great White North, all unauthorized expressions of joy have been strictly prohibited this summer. If you're caught singing, cheering, or handshaking in public, you can be fined $1,000. But that's Canadian dollars, not real money. I mean, look at this. Well, why wouldn't I want to follow the directions from the Prime Minister